In Libya, protesters in the eastern city of Derna have burned down the mayor's home as they demanded action against public officials whose alleged negligence may have worsened the damage caused by last week's catastrophic flooding. They gathered at the city's landmark, Shahaba Mosque, calling for the sacking of top officials in Libya's eastern government. The devastating floods killed about 4,000 people, according to revised figures, with around 10,000 people still missing. Survivors are blaming officials for failing to issue proper and timely warnings about the floods. They've also accused the leaders of failing to order the repair of 2 dams near the city, despite prior warnings about their poor condition. Journalists in Derna say they've been asked to leave by local authorities. CGTN's Wanja Mungai has more.
Since the 10th of September, floods that washed away parts of Derna, killing thousands, life has not been the same again for the city's residents. Many bodies remain trapped under the rubble, while hundreds more continue to wash up on the Mediterranean coast. The corpses have begun decomposing. However, World Health Organization officials say the risk of that leading to the spread of diseases remains low.
Many people are focusing on the dead bodies and the dead bodies that started to decompose in some areas. I have to say that there is no evidence to back the fact that dead bodies will transmit diseases. The only possibility is when those bodies have died from certain communicable diseases like Ebola, like cholera, like things like this. It's not the case in Libya. This is a national disaster, and there's very, very slim chances that those bodies are already infected with some high pathogens.
Public health officials in Derna and nearby areas are, however, not taking any chances. They've been sanitizing walkways and public spaces to minimize any risks of diseases spreading. The WHO warns that lack of access to clean water could pose a health hazard. It also says remote areas in eastern Libya urgently need more medical equipment, teams and medicine.
If they don't have access to safe food, we might start to see some cases of foodborne and waterborne diseases. There is need to get medical equipment, medicine and medical teams to some remote areas also. That can happen either through fixed facilities or through mobile clinics. WHO is already working on importing some mobile clinics. We are working already on taking the medicine and the medical equipment that arrived yesterday and the day before to as close as possible to the population.
Meanwhile, efforts to retrieve corpses from the rubble and in the sea are underway, with hundreds of bodies recovered so far. Wanja Mungai, CGTN.